Nasal feeding, for the elderly who cannot feed themselves by mouth, elderly people who are in a coma, elderly with oral disease or after oral surgery, elderly with swallowing difficulties caused by upper gastrointestinal tract tumors, etc., elderly who cannot open their mouths, such as those with tetanus, other elderly people, such as those who refuse to eat due to a critical condition. The above groups of elderly people, they need to use a nasogastric tube to supply food or medication to maintain their nutritional and therapeutic needs. Specific operation methods are as follows. Nasogastric feeding. First, an assessment is performed. Environmental assessment. Evaluate the environment for cleanliness and absence of odors. Assessment of disease awareness of the elderly. Local assessment. The main assessment is to check the patency of the nasal feeding tube. Diagnosis. After assessment, it is determined that the elderly require feeding. The elderly person is unable to eat by mouth independently. The elderly need nasal feeding tube feeding. Plan. The plan is to feed the elderly via nasal tube in half an hour. Nasogastric tube feeding. Execution. Preparation includes warm water at 38 to 40 degrees Celsius. 100 milliliters nasogastric feeding syringe. Dirt tray. Towel pads. Paper towels or towels. Caregiver prepares their own clothes and washes hands thoroughly. Communicate and explain to the elderly. Help the person to get into the right position. Raise the head of the bed 30 degrees. Use a soft pillow to cushion the head of the bed. Make the elderly person lie on their right side or in a semi-sitting position. Help the elderly to put towels and dirt trays under their jaws. Keep the bed unit clean. Check the integrity of the skin where the nasogastric tube is fixed. The skin is intact with no breaks. Keep the nasal feeding tube secured at the 45 to 55 centimeters mark. Check that the tube is in the stomach. There are 3 ways to do this. Firstly, connect the end of the tube to a syringe. Apply suction. The presence of gastric juice or gastric contents proves that the tube is in the stomach. Secondly, use a syringe to draw 10 to 20 milliliters of air into the nasogastric tube. At the same time, use a stethoscope to listen for gurgling sounds in the stomach area. This proves that it is in the stomach. Put the end of the tube into a glass of water. If no air bubbles come out, the tube is in the stomach. Confirm that the tube is in the stomach. After confirming the tube is in the stomach, begin feeding the elderly. After preparing the nasal feeding solution, draw 10 to 20 milliliters of warm water at 38 to 40 degrees Celsius. Use the inside of the forearm to test the temperature. Slowly inject into the tube for lubrication. Draw 50 milliliters of nasal feeding solution at 38 to 40 degrees Celsius. Slowly inject into the gastric tube. Infusion rate, 11 to 13 milliliters per minute. Close the cap of the tube immediately after each infusion, until feeding is complete. Flush the tube with a final 10 to 20 milliliters of warm water. The total volume of each feeding should not exceed 200 milliliters. The interval between feeds should be more than 2 hours. During feeding, monitor the elderly's reactions closely. Respond in a timely manner. Tidy up and remove the towel. Make up the bed unit. Wash and sterilize nasal feeding materials. After feeding, instruct the elderly to stay in the feeding position. Maintain this position for 30 minutes after feeding to facilitate digestion and absorption of food. Record the duration and total amount of nasal feeding. Assess the elderly for any discomfort after the procedure. Tidy environment. Dispose of waste properly. During nasal feeding, for elderly on long-term nasal feeding, pay attention to. Provide oral care at least twice daily. Keep the mouth clean. For those who need sputum suction, suctioning should be done 30 minutes before nasal feeding. No sputum suctioning should be done within 30 minutes before and after nasal feeding. Avoid food reflux or aspiration. 3. When medication is needed, tablets should be crushed and dissolved before administration. When abnormalities are detected, if the nasal feeding tube comes out, abnormal aspiration of gastric fluid, nausea and vomiting during nasal feeding, skin breakdown at the fixation site, etc., notify the medical staff promptly for treatment. That's all for this lesson. Thank you, everyone.